Najljepša hvala glavnoj savjetnici ministra zdravstva, gospođi Bogut Barić. A poštovani, stigli smo i do zanimljivog tematskog područja, Projekt Pacijenti u potrazi za mjerljivim zdravstvom. Pridružit će nam se relevantna stručnjakinja, cijenjena gošća predavačica, koja se inače zalaže za stvaranje vrijednosti poboljšavanjem komunikacije i iskustva pacijenata. Svi znamo da u organizacijama, u sustavima gdje se uz sve ostalo i dobro komunicira s pacijentima, taj cijeli put kroz zdravstveni sustav, tijek liječenja uvijek završava boljim ishodom ako su pacijenti upućeni, motivirani, slijede terapijski plan i u konačnici sve to dovodi do smanjenja troškova i do optimizacije i korištenja resursa. Želim vam samo podsjetiti malo tehničkih detalja da ćete tijekom predavanja, naravno da ćete pozorno pratiti, ali možete razmišljati i pitanja koja vam se nameću možete postaviti našoj cijenjenoj predavačici, tako da skenirate QR kod i u aplikaciji Slido postavite pitanje. Na kraju predavanja odgovarat ćemo na vaša pitanja, na nekoliko pitanja s obzirom na vrijeme s kojim raspolažemo. A inače, predavanje naziva Value-Based Healthcare ili u hrvatskom prijevodu nešto malo duže zdravstvena zaštita temeljena na vrijednosti. Održat će nam doktorica znanosti i glavna urednica stručnog časopisa Journal of Patient Experience. Dakle, pridružit će nam se Laura Cooley. Mrs. Cooley, where are you? Okay, applause. Welcome, floor is yours.
Hello. Good morning. I wish that I could speak with you in the Croatian language. I will do my best to speak with you in English, and I hope that you can understand me. So welcome. Today we'll be talking about measuring what matters, reframing patient experience to drive value. So you heard the word Journal of Patient Experience. I'm here in my role as the editor-in-chief for an academic journal. We publish research on patient experience and outcomes that matter most to patients for improving their healthcare experiences as well as their quality of life. And if you see the QR code, that will allow you to access all of the articles. They are free for you to read. So let's talk about our goals for the time that we have together. I have several goals. One of the goals that feels most important to me is that you have a chance to think, as my friend here is doing, and also to share ideas with each other. So I want to forecast for you that because much of my career has been focused on communication and relationships in the healthcare environment, I believe that the most important thing for forming a new social contract in health is building trust and understanding within the healthcare community. So I'll be inviting you during our time together to share ideas with each other about how we might form this new social contract in healthcare by thinking about value-based care and patient experience and how those things connect, why patient experience is important, how we can measure patient experience, and also what strategies we can put into place to improve patient experience outcomes. So this may feel a little bit different. I'm going to invite you into an activity. So during this activity, I will encourage you to speak with someone. I will set a timer. When the time for speaking is finished, you'll hear this sound. This is to invite you back to listening rather than talking. So my first goal is that you will find a partner. If you are not seated near someone, I invite you to find someone. As I mentioned, we will have new friends and new relationships. So I invite you to find a partner. Thank you. And I invite you all to help me know if my English needs improvement. I hope that this question makes sense to you. The question with your partner, you'll want to introduce yourselves, of course. What matters to you about the new social contract in healthcare and why? So I will tell you that a new social contract in healthcare for me matters because I see that people like myself and my family and your families, they are often suffering and their lives are shorter and lower quality than I wish they were. And I want us to see less suffering in healthcare because it matters to my family and to yours. So with your partner, I invite you to tell why you care about a new social contract in healthcare. I'll give this about 90 seconds, a minute and a half. You may begin. Okay, I invite you back to listening. I hope that you exchanged some ideas, and throughout this time we have together, I'll invite you to share your idea. If you'd be willing to share something, who would like to say what matters to their partner about the new social contract in healthcare? And if you will, please, would you say it in English? Who would like to share something you heard from your partner? Yes.
That my partner Maya said that for her the most important thing is honesty, because without it we cannot build trust and we cannot build change.
Honesty. Without it, we cannot build the trust that we need. And I know that trust is something that we're thinking about at this event. Thank you for sharing that. I told you what matters to me. I want to tell you some research that was published in 2021 in the British Biomedical Central Health Services Research Journal. This is research emerging from a quick study at 66 hospitals in 7 different countries, representing a very diverse population of more than 1,850 patients. All of these patients had just been admitted for an acute condition, so something that felt very significant had brought them to the hospital. The question was, what matters to you? What matters most to you right now? And for most of them, they said getting better, their general health, and I'm going to tell you more about what they said. They also asked, why does it matter? And I'll reveal to you some of the answers from this research. First, I want to bring this to life with a story, a patient case. This man we'll call Ronnie. And we'll think about what matters to Ronnie. So Ronnie has just seen his physician because he's about age 61, and he has retired from working. He spends time with his family. He likes to attend church. He likes to walk and go on hikes. He likes to garden. He has suddenly started to experience extreme fatigue, back pain, indigestion, and now he has a mysterious lump that has formed on his neck. He's very uncomfortable. He goes to see his doctor, and his doctor has the lump removed, and now Ronnie is waiting for a biopsy. So my question for you, to think and to share with your partner or partners, you may have more than one partner, what is Ronnie, what is the patient thinking and feeling in this moment? What matters to this patient? What does he care about? What is important? What matters? What is he thinking and feeling? I'll give you about a minute, and then I will ring the chimes. You may share your ideas. Who would like to share some ideas, a word or a phrase? What do you think this patient is thinking or feeling in this moment? Anxious. What? Fear. What else? He would like to be diagnosed quickly. He's having a lot of ideas, emotions, worries, concerns. here are some of the things that when we heard from the research, the research study that I cited earlier with 1,850 patients, these are all the things that they were thinking about, that what mattered to them. And I think if we could speak with this patient, if we could speak with Ronnie now, we would find that he has a lot of the same concerns. The number one thing that people said in this research study is that they wanted to be better. They wanted to feel better, to have good health. Why? Because they want to be with their friends and families. They want to have a normal life. The second reason, especially when people have been admitted to the hospital, is that they want to go home. They want to stay at home, and they want to be more comfortable. The reason they want to be at home is often because they have other people in their lives that they might need to take care of. And then the third reason, and for the patient in this case, Ronnie, having a diagnosis, because we want to feel less anxious and less insecure. We want to know what's happening so that we can receive treatment, so that we can get the help that we want and deserve. And in the study that I cited, more than half of the people who were invited to respond said that their provider, their doctor, did not know what mattered to them. Why doesn't the doctor know what matters to a patient? It's because we rarely ask them. We rarely say, what matters most to you? We make an assumption that Ronnie wants to have his neck lump removed and diagnosed. We don't think about all the other things that could be going on. So I want to tell you what matters to me about the story. I use this story because Ronnie was my father. And more than 10 years ago, after his diagnosis, he went through 2 years of very extreme chemotherapy treatment because the lump in his neck indicated cancer. And I had studied communication in healthcare and how doctors and patients communicate, but I really became educated on the last day that I took my father to see his doctor, his oncologist. And the doctor rushed into the room and he told us what the next chemotherapy option would be, and then he was ready to leave the room. And I said, wait, please, I have several questions. And so he sat down with us and I asked the hardest question. If we try this chemotherapy, what will the quality of my father's life be? He could no longer walk on his own. He had to use a wheelchair because the brain cancer had spread to a very difficult place. And the doctor was honest. And we knew we could trust what he said. And that was that at most, my father could expect 6 to 12 months, and that his life would be very low quality. And my family made a decision that day that my father would no longer take chemotherapy. And in 30 days, my father was no longer alive. And we were grateful because the communication and trust that we had with the doctor in that moment, when he became an authentic person with us, made all the difference. And that's what I care about when we think about a new social contract in healthcare, is that people feel heard and respected, and that what matters to them is what we're thinking about in service to their health needs. Because typically, this is what we think about when we think about patient care. What's wrong with you? What's wrong with you? But I would like to change that. It should not be what's wrong with you. An authentic value-based question is what matters to you as a person. So we're going to continue to think about what matters to people as the pathway to a more authentic value as we move into our first real goal for today's session, and that is, how do we define value-based care and patient experience? So I did give you the warning that you would communicate and build relationship. So you may want to meet a new partner if you have a desire to meet someone new. If you did not have a partner before, welcome. The question for the next 1 minute or so is, how are you defining these two things? What is value-based care? What is patient experience? I invite you for 1 minute to talk with someone near you. I invite you to tell me some words that you're discussing in this conversation. Maybe you need more time. Do you need more time? Okay. What are some words that come up? What do you think about when you see the phrase value-based care? Let's start with that. What does value-based care mean to you? What are some words that come up? I'm sorry? Empathy, okay. Empathy is a very common word associated especially with patient experience. What else? What other words came up? Outcomes? Did you hear outcomes?
Times for me, it's the most important in communication between a patient and the medicus. If we have not enough time, tako da kažem, mi smo stali. We are stopped.
So communication and time.
Yes.
The time to communicate and to invest. I heard something here, but I didn't hear. Ready for one? Value for money. Thank you. Thank you. Value for money. Cost, money, finance, right? So I know you have lots of other ideas. We'll continue to think about this. I think one reason I might have been invited to visit with you, for which I'm really grateful, is that in the United States, where I live, the United States government made a big commitment to the idea of patient experience more than 15 years ago and started to require that hospitals and then clinics and outpatient ambulatory clinic systems had to measure patient experience, and they provided metrics and tools by which to do that. I'll tell you more about those as we go, but the Center for Medicare and Medicaid Services in the US says that it's a range of interactions that individuals have with their healthcare system, and it's an integral component of healthcare quality. This is how we are defining patient experience in the US. I'll say more. And I want to give you reference to an organization that has a lot of resources, the Barrel Institute. When they think about patient experience, they think about patient experience as the sum of all of the parts that are considered our healthcare, and that the organization's culture influences the patient's perceptions across their entire care journey. So every moment that they have in relationship to healthcare. A lot of people think about patient experience as being happy, but our patients do not need for us to think about happiness. They want to be cared for. So when we think about patient experience, it's not about being happy. Another reference I want to give you is the Picker Institute of Europe and the principles that they use to describe patient experience. So I'll just turn with you as you review this. The Picker Institute is a helpful resource because more than 20 years ago, there was a starting of this in the United States to identify how we could measure and assess what real value looks like when it comes to patient experience. So fast access and reliable care, efficient treatment by trusted professionals, the continuity of care and having smooth transitions, involving families and caregivers, having clear information and communication, involving people in the decision so that they can feel respected, having emotional support and empathy, and paying attention to the physical environment, the space around us. These are all principles of what it means to really be person-centered and to develop a patient experience framework. And I often hear people confuse the terms patient experience, patient satisfaction, and patient engagement. So I want to define the difference between these. When we talk about experience, this is what actually happened and how often. When we think about satisfaction, it's about how well patients' expectations were met. Did they get what they thought they should get? And then engagement is actually the critical factor that can help people change their behavior. So if we see that our behaviors are impacting our health outcomes, then this is a true opportunity to think about engaging people in taking care of themselves. And the proposition that I make to you is that if we can improve how people experience their care and how well their perceptions and expectations are satisfied, they are greatly more likely to be engaged. They're better likely to take care of themselves, and that's why we're connecting the dots. So, for example, the experience is, did I feel cared for? Did I feel heard? Was I listened to? My satisfaction might be about, well, were my efforts made to give me the care I need and to provide access? And engagement is about being willing to return to a clinic, being willing to follow a treatment plan because you shared in that decision. And when those three things happen, we can see more value. So when we define value-based care, one of you mentioned money, finance. Oftentimes people define value-based care, especially in the US where I live, by cost, saving money. And we're often looking at contracts and the codes that we label care with. But value is really about quality at the top. And we measure quality by the outcomes and the experiences that patients are having in their healthcare experience. So until we measure the outcomes and measure the quality metrics, we really cannot determine value because there is no value unless we are delivering on the outcomes and experiences that people need to take better care of themselves. So when we think about saving money, that's not what we mean when we talk about authentic value. So I'm talking only a little bit about value-based care because patient experience is a key metric in that. And so my work is all around patient experience. I want us to think together about why patient experience is important. So I'm going to just give you a moment to think quietly. All the reasons why patient experience might be important and why we're talking about measuring it. I mentioned the Barrel Institute, which focuses entirely on patient experience, outcomes, and improvement. And they recently published an article that you can access for free called The Value Case for Human Experience in Healthcare. And one of the things I like about this diagram is that they point out that human experience is at the center of what we mean when we talk about health and care. And that the way that our workforce and our team who are taking care of patients are experiencing their work intersects with the way that our communities are viewing their consumption of healthcare and the way that our patients and families are partnering with us in healthcare. And there is a certain amount of the organizational experience and the finance and the business that all come together to help us understand why patient experience is important. What you may or may not know is that there is a lot of research that shows that when we help people have better patient experience, they not only see better health outcomes, but the organizations and healthcare systems that provide that care also see reduced costs and better improvements across the spectrum, because when people are more satisfied with their experience and they feel heard and cared for and respected, they're more likely to come back to see their doctor more frequently in a way that will help them have better health care. They're more likely to encourage their friends and family to also seek health care. And so the experiences make a big difference. Now, most of the healthcare systems that I talk to, especially my own in the US, are very concerned about finance because the cost of care is only rising. A study that was published several years ago by a major company in the US, Deloitte, and they're also international, tried to outline all of the research showing why patient experience drives value. And one of the things that came up in the article is that value-based care is looking at all 4 domains. This is how we measure it in the US, and we have a lot of room for improvement, but this is still how we're trying to measure our quality. But patient experience and clinical outcomes and safety and efficiency and cost. And all four of these come together. And patient experience is actually an influencer of all of the other domains. And so one of the reasons why we think about patient experience in connection to value-based care is that when we look at hospitals and their financial margins, we see that the hospitals who have excellent, which is indicated by the dark blue color, excellent patient experience ratings, they also have higher profit margins. And you may or may not be interested in seeing hospitals have high profit margins, but what you might care about is finding ways to reduce cost while also helping patients have better experience and outcomes. So the last thing I'm actually concerned about is usually the financial aspect of healthcare, and it is an important dynamic because we must be able to afford what we're trying to deliver for our patients. And I think an important thing for those of you who are working in healthcare is that we see that in hospitals and healthcare organizations who have better staff engagement, better engagement from their clinicians and doctors, they also see better financial outcomes. So the better our patient engagement, the better our patient experience, then we see better staff engagement and better staff experience, and we also see better financial outcomes. So if we believe that patient experience is important and that we should measure it, the question becomes, how do we measure it? So my understanding is that you may or may not be measuring patient experience or researching patient experience in any consistent way. You may or may not feel that that's something that you're ready to do. I'd like to invite you to think about ways that we can measure patient experience. So I'm going to give you another chance to speak with a partner. And the question is, what ideas do you have about how we can measure patient experience? How do we know whether patients are having a good experience or not? So I'd like to invite you to speak with a partner, again, for another 90 seconds. You may begin. It sounds like you have many ideas. I'm imagining that some of the ideas you came up with will appear on the next slides. So I want to talk about the different types of quality measures for a moment, because when we saw the definition of value-based care, we know that quality measures, the patient experience and health outcomes in relationship to cost, are what we mean when we talk about value. So the three different measures that we can look at, these are domains of measurement. One is structural. So can the provider or the hospital have the capacity to deliver on high quality care? What is the number of doctors that they have to take care of each patient, for example? Or what is their electronic health record look like? The second are our process measures. Most healthcare quality metrics, at least in the US, are process-based. So what is a healthcare provider or hospital system doing to maintain or improve health? So this might mean how many preventative screenings are they having? How much are they doing regular testing to find out if people have diabetes, for example? And then the third category of quality metrics are around outcomes. And what I wish is that we saw more measurement in the outcomes domain. Unfortunately, even though in the US we measure a lot of outcomes when it comes to quality, we're often measuring things like mortality, what is the death rate, and errors, like how many times are things going wrong or poorly. What I hope for is that we can start to think about patient experience as a metric that runs across all of the different quality metrics, because the patient's experience is impacted by each of the domains that we see here. So if we really think about measuring what matters, there are two types of patient-reported measures that we can look at. An organization that you may want to look up is ICHOM, the International Consortium of Health Outcomes Measurement. They provide a lot of tools and resources that help you measure things like patient-reported outcome and experience measures. So there is a difference in these quality measures, and the first difference I'll say is that when we look at a patient-reported outcome, it's really thinking about the health quality of life. So are people able to function and live in their lives the way they want? What are their symptoms, the burden of their symptoms? Are they having pain or fatigue, for example? And what are their behaviors? So when we're trying to change things like management of diabetes or obesity, or even the factors that lead to increased cancer, we have to think about health behaviors. So we have to find a way to get our patients to tell us how their outcomes are impacted. And the experience metrics are actually separate from this. Experience metrics are about how people are accessing their care and the type of care and what happens in that care that they are receiving. It's not actually looking at health outcomes. So when we think about measuring value, we really need to be able to look at both patient-reported health outcomes and experience measures. In the United States, we look at a program for experience measures called the Consumer Assessment of Healthcare Providers and Systems. This is our mandated regulation of patient experience, and it's part of the quality domain and part of how we measure and pay for value-based care. Just like you, in the US, we are trying to change and improve our healthcare outcomes, and we have a lot of work to do. And one of the things that has become an important commitment is understanding patient experience. So how good is our communication with our healthcare providers? How coordinated is our care? How easy can we get the information that we need? And how able are we to schedule timely appointments? And when we think about a standardized program in healthcare patient experience, one of the goals for this is so that we can really assess in a research-oriented way what's happening for our patients and what their outcomes look like, and so that we can increase transparency so that people who are going to receive care can actually know what's happening in the healthcare systems that they're visiting. And then last is that we use that data, and this is what matters most to me, that data can help us improve and find the ways to improve. So in our last several minutes together, I'm going to talk about some strategies, and I'm going to share a case study from the University of Utah. And if you're interested in more research, there are case studies from many, many health organizations where they've implemented a patient-centered, patient experience approach. And this approach was launched in the year 2008 because this university health system with over 24,000 employees realized that they were suffering in their healthcare domains because they did not have good decision-making processes. They were not accountable. Nobody was measuring things and reporting it. They felt that their staff and clinicians had the wrong attitude. They were not focused on their patients as the center, and they really were not clear on their mission. And when they looked at their actual metrics, they did become accountable for patient experience measures. So when they started the study, they were in what we call the 34th percentile in the required patient experience metrics in the US. And when they started their initiative to improve and measure, what they saw quickly within the first year is a move from the 34th percentile by comparison to all other health systems in the US to the 51st percentile. And by the second year, they moved to the 72nd percentile. And by the 6th year, they had moved to the 80th percentile. And those percentiles are really important in our US system because it's part of how we calculate the funding that is needed to take care of a particular health system. So I want to just give you a very quick overview of what they actually did and what the impact was. So one of the things they did was focus on measurement. So they used surveys and interviews to collect feedback from thousands and thousands of patients every month, every year. And what they saw is that their providers, their doctors, moved from only being at the 50% mark in terms of quality ratings in the US to the top 10% nationally due to the initiatives that they put into place. They also saw that as they improved on their quality metrics, all of the quality metrics I described, that their costs decreased and their ranking in the US climbed to the top 10 within US health systems. They additionally saw that their employees were more satisfied and that they had fewer complaints and errors with the care that was being delivered. And this has become increasingly important. They saw that their reputation improved. People began to trust the system more because they were giving feedback and there was action taken to improve on the patient's experiences. So when we think about the ways that this case study and many other health systems are measuring patient experience, these are the things that they're looking at. And some of the ways that we measure patient experience is through patient experience surveys. So those can be distributed traditionally through paper, so people were mailed a survey. Today we're using email and text messages to distribute questions that help us understand how we are performing when it comes to experience. Some of the questions that are measured most consistently, and this also would be found when you look back to that Picker Institute of Europe resource, is they have an overall assessment. So how likely are people to recommend this health system? How well did the staff work together? There's an overall access assessment. So how easy was it to get an appointment? How convenient was it to visit during the office? How courteous or respectful were the staff when you arrived? And what was it like when you were moving through the health system? Did you get information about delays or wait times? And I think that the domains that actually have the highest impact in terms of what patients do to take care of themselves fall into these categories. How friendly or courteous was the nurse or doctor? How much did they show concern for you? Did they address your worries and what mattered to you? Did they help you be included in decisions? Did they give you information about medications? How often did they give you the instructions that you need for follow-up? Did they speak in a way that you could understand using plain, clear language? How much time did they spend with their patients? All of these factors come into play when we think about the outcomes that people will have with their health, not just the experience. And then lastly, the thing that is measured in patient experience surveys is just the overall safety, how sensitive we are to what patients need, and the privacy that patients want to have, as well as, of course, how clean our hospitals and practices are. So I'm going to wrap up by inviting you to think about some of the strategies to improve patient experience. There are many, and some of the essential elements of a new social contract that includes healthcare experience can be found through other resources. I mentioned the Barrel Institute. I'm not affiliated. I do think they have a lot of great resources, such as a roadmap for action that they published online last year. It's free and available, and it looks at many of the proven strategies that you can implement to enhance patient experience in your health organization. One of the biggest domains is enhancing communication, providing training, improving the environment and amenities, leveraging technology. But at the core, when we can collect these patient-reported outcomes and strengthen the way that our leaders are measuring these things, then we can really see changes. And the University of Utah Health that I described in our first case study used many of these same strategies, starting with the accountability of their leadership and collecting data so that they could ultimately report to the public and improve the way that public trust could be with their experience expectations. So, as we close, I invite you to think about how we can even begin. There are many things to measure. There are many programs to consider across the board in healthcare. When it comes to patient experience, 3 of the biggest priorities that you saw on the list I just described are about patient-reported outcomes, strengthening leadership, and enhancing communication. And if you'd like to learn more about strategies for enhancing communication within the health system, you can look to case studies like the Cleveland Clinic, where they focused on improving physician communication and found that not only did the skills of physicians impact the outcomes of their patients. For example, there's a study that was published in 2011 in Academic Medicine showing that people who felt their doctors were communicating and expressing empathy were much more likely to have improved hemoglobin A1C, so there's sugar that we're measuring in diabetic care, and HDL cholesterol, which are leading little metrics that help us know how healthy people are when their doctors are communicating better. We also see that our doctors feel better when there's better patient experience and communication. And there's also an interesting case study published by the Mayo Clinic about improving communication for providers and noticing that when they do this with intention, they saw an 18% reduction in patient complaints because patients want to know what their condition is, that their ideas are being considered, and that they are being known as a person. So we've discussed a lot of things in our time together. And as we move to wrap up, this is a quick review. I'll end with this idea of a virtuous cycle. And a virtuous cycle is defined as a chain of events that leads from one desirable outcome to another. And so what I encourage us to think about when we're trying to measure an authentic version of value-based care that focuses on what patients and families care most about, we must consider all of these things, and the patient experience is at the root as a driver for this virtuous cycle as we really measure what matters most. So thank you, and I invite any questions you may have.
Thank you, Mrs. Cooley. Do we have some questions on our... Let me see. Oh, it's too small. Two questions. What are some easy... Okay, thank you. Okay. Okay. Could you give us a specific example of implementing value-based care on a policy and on a clinical level that was efficient in the USA?
Well, this is a great question. I think one of the biggest things that I will point to is that I mentioned that we have this program called CAPS, the Consumer Assessment of Healthcare Providers. And I think that the requirement of a patient experience metric has made a big impact in the US on being able to deliver value. There are still many ways that our system needs to improve, but because it became a requirement for all hospitals who receive government funding to measure their patient experience using a proven tool, it became a priority in the United States, so that now almost every hospital system has a specific quality department focused on patient experience. They have staff who are measuring, evaluating, and responding to patient experience needs, and they're constantly looking for ways to improve the experience outcomes that people are having. And while it's not perfect, I do think that that policy has pushed our doctors, our clinicians, to stop and care more about the experience and communication that they're having.
What are some easy ways to measure how patients feel about their care?
So using a traditional survey method, sending a text message or email, that's an easy way, as long as you're asking the right questions and sending those surveys in a timely manner that people can receive them. The other way, and I would love for you to read the study, it's free and easy to access online, about measuring what matters. I mentioned in 66 hospitals in 7 different countries, their study was simply to approach patients, ask for their permission to participate, and then they asked them 2 questions. What matters to you about your health, and why? Why does it matter? Okay? They also asked a follow-up question. What is your perception of whether your doctor, your provider, knows what matters to you? Does your doctor know what matters to you? So forming simple questions and actually asking people in a very few short moments and then capturing that can give you data that will help you know what's happening for patients.